What's going on, Walter Q Banks? This is your boy Shed G, and just like Walter said, I am located here. Well, not I, but we are located here, which is Brookdale Health on 5740 Brooklyn Boulevard on the corner of Bass Lake Road and Brooklyn Boulevard. And just to let you know, Brooklyn Boulevard and Bass Lake Road is where we are, right on the corner. You cannot miss us. And Brookdale Health is the experts in auto injury. And I just happen to have one of the doctors here, and I'm gonna see if I can get it right. Dr. Frisch.
That's correct, Shed.
All right, we got it right, Dr. Frisch. Now, you deal. What is your position here?
I'm a doctor of chiropractic here at Brookdale Health. Brookdale Health utilizes a lot of different approaches. We have physical therapists on staff, doctors of physical therapy, physical therapist assistants, doctors of chiropractic. We have massage therapists. We have a wide array of different treatment options here that we all utilize in tandem to get patients better.
Okay, and so we have all of those things. Now, I've been going through a lot of process of dealing with some of the entities that you have. So I did physical therapy, and I'm going to talk about that with one of the physical therapists that come in. But let's talk about chiropractic, and you know how nervous I was about that.
Exactly, and a lot of people are nervous on something they don't really know. I mean, they see movies or clips on TV shows. I think 2.5 Men had a clip about Alan being the chiropractor, cracking people. You know, that's what their experience is. So they're a little nervous. They don't know what to expect. The biggest goal with us is to have them calm down, let it be a comfortable environment to figure out what injuries they're dealing with, what conditions they're dealing with, and give them the best treatment we can.
And you know what? To be honest with you, the best thing is I can talk to you about personal experience. When we was in there, I was so nervous, and I didn't realize how nervous I was. And you took my blood pressure.
Yeah, the blood pressure never lies a lot of the times. When we get patients, I can always tell if somebody's anxious, if they're in a lot of pain. Typically, your blood pressure goes up, your heart rate goes up. So you get a real idea on what the patient's actually dealing with versus, somebody maybe lying or something like that.
Right, and one thing that I loved about here at Brookdale Health, and you especially, is that you explained everything to me in layman's term, which made me understand. Like, you told me about the high blood pressure and how it works with the heart. Yep,
exactly. I mean, how I explained it to you is a lot of people think of high blood pressure like, oh God, high blood pressure. What does that mean? How does that relate to me? I always tell people, think of your heart as a fist that's going open, close. So you're making an open hand, closed fist. It's doing that constantly, sometimes 72 times a minute. It's going normal. High blood pressure is like throwing a tennis ball or a stress ball in your hand and telling it to do that as many times. It's more pressure, it's more stress on the heart. That's why it's important to keep that under control.
Right, now let's get into the chiropractic now. So I was nervous, and we did some stretches, we did some things, but then I was so nervous about, because the one thing is always bones cracking, and you explain something to me on that, which put me more at ease.
Yep, and a lot of the times that is people's biggest fear when they go to a chiropractor. They're afraid of that popping, cracking sensation. And all that is a cavitation. And what a cavitation is a gas bubble that forms within the joint. And you have people that crack their knuckles all the time. The reason they can do that is they'll crack their knuckles, 20 minutes later they'll crack them again because that gas bubble gets reabsorbed. It actually never leaves the joint. It's never bones that are grinding or snapping and cracking. There's different feelings for that and different tests to rule stuff like that out. But the cavitation is perfectly normal experience. It's kind of a phenomenon in one way. And there's been MRIs that have shown that's what it is, a gas bubble in the joint.
Okay, and last but not least, we're going to talk about this little thing. I think it's called an activator.
Yep.
Because I was nervous about twisting my neck a certain way or pushing, but you use an activator. What that little device? I mean, what is that?
Yep. So it's an adjusting instrument. I always tell people this is the 21st century. We don't have to pop and crack joints with our hands. We can utilize science and innovation and use instruments to adjust the joints. The instrument allows us to be very precise and not have that cavitation sensation, but also give a great adjustment.
Right.
So a lot of people that are nervous about that manual adjustment and the cracking sensation, we can utilize different approaches. I always tell people we can tailor a treatment plan to your needs the best we can.
Oh, and I'm so thankful for that. And next time I'm gonna come in, I'm gonna want to experience, the WWF moves and all that to help crack the joints.
We'll see what we can do. Let's put it that way.
Okay, now we're here at Brookdale Health, so make sure you come in and just pretty much just come in and just see what we're about, because we are the experts in auto injury treatment. And make sure you follow us on Facebook, Instagram, and Twitter, Brookdale Health, and that's at Brookdale Health, or go to our Facebook page and follow us there. And just give us a call at 763-561-4045. And I'm swinging things back to you, Walter Q Bear Banks, 89.9 KMOJ.